Many Central Texans have lost their jobs due to the economic hit from COVID-19, but the demand for medical professionals is higher than ever. One local training program is helping to meet that demand by lifting people out of lower wage jobs and into a career in nursing. Samantha Guzman has that story.
More than 1.3 million Texans have filed for unemployment since the COVID-19 outbreak. One organization is trying to help people get back to work.
Our mission, ever since we started 20-some years ago, is to get low-income people into high-paying careers that are in demand by local employers.
Through programs with Austin Community College and Temple University, Capital Idea strives to get job training for low-income people in Travis County.
I mean, we're about helping folks who are stuck in dead-end jobs, but they have the passion and the aspiration for something better, and something better that's in demand by Austin employers.
And one of the jobs in demand right now is nursing, Capital Idea's #1 program.
We've got 30 nurses graduating in a couple, 3 weeks. They're all on schedule to graduate. They're already getting job offers. We anticipate that that's not going to slow down even when we get past the peak of the COVID.
That high demand has shifted the duties of some nurses in the field. Dolores Constantino graduated from the Capital Idea program more than 10 years ago. Before the pandemic, she was a charge nurse at a pediatric clinic. Now, she's working with the COVID-19 registry.
When anyone from the community decides to get tested, then once we get the results, we call them back and take them through the process of what to do, whether they're negative or positive.
Joanna DeCrescenzo graduated a year ago. She's a nursing supervisor for a home health agency. COVID-19 has changed her job as well.
So when I was hired, I was going out into the patients' homes, meeting with the nurse, whoever was caring for that patient, meeting with them, the parents, doing an assessment on the patient. All those things now we're just doing via telephone.
Both DeCrescenzo and Constantino came into the nursing field later in life. DeCrescenzo was a stay-at-home mom, and Constantino worked as a receptionist before entering a program with Capital Idea.
Capital Idea came along, and I did with them LVN, and then about 5 years later, I went back with them again to do my registered nurse license. So my life has changed, definitely.
I went and got a associate's degree RN at ACC, and I'm planning on going back and finishing up and getting my bachelor's. But right now I'm an associate RN, and that took me a long time, actually. I worked at it really hard. It was there's nothing easy about going through nursing.
DeCrescenzo credits Capital Idea with getting her through the nursing program.
You know, they give you a lot of support. It makes the difference between people who can get that degree and people who can't.
She believes programs like this will help meet the demand for more nurses.
I would think that, you know, people when they're thinking about choosing their career would really think about nursing and, you know, MDs and nurse practitioners, all those, because that's a job that's very, very needed in a situation like this.
Meeting the city's job needs while providing a quick opportunity to change careers has always been Capital Idea's mission. For now, they are just moving things online, and the lessons they've learned will last long after the pandemic is over.
Yeah, we'll have more choices for education in the future. There will be virtual tools developed to not substitute for, but complement the scarce bedside clinicals that are part of a nurse's education. So we're getting pushed in a direction that we needed to go anyway. And the smart thing for us to do is to go with that flow and not lose track of what has to happen today, but also not lose track of what's on the horizon and where we need to go 6 months from now, a year from now, 2-3 years from now.
This reporting is sponsored by the Corporation for Public Broadcasting's American Graduate Get to Work initiative. For more information about Central Texas job opportunities, go to austinpbs.org/American Graduate.